Okay, my name is Cecilia Rodriguez and I'm doing my bone video. This is your clavicle. This is the acromion end. Then you have the sternal end. You also have your coracoid proxus, which is right here. Then you have your glenoid cavity in here. You also have your subscapular fossa, which is up in here. If I turn them around, then you're gonna see the spine. The spine's back here. Okay. The supraspinatus fossa is right here. The infraspinatus fossa is right here, number 10. You also have the sternoclavicle joint, which would be right up in here. And then you got the acromion joint, which would be right in there. Okay. Now moving to the arm. Okay. The arm, I know this is the left, correction, yeah, this is the left arm, but let's pretend it's the right arm because it's a little backwards on me. Okay. This is the humerus. Okay, that would be the humerus. This is the head of the humerus. Okay. The head of the humerus would be that. Then you have the greater tubercle, which would be number 14 right here. Then you have the lesser tubercle, which would be number 15 right. Correction, number 16 over here. Oh, sorry, greater tubercle, lesser tubercle. Once again, greater tubercle, lesser tubercle. Okay. Then you have the deltoid tuberosity, which would be number 17, which is, it says 18, but it's actually 17. I'll show it right here. Okay, where you see that number right there. Then you have the lateral epicondyle will be right here. Okay, the medial epicondyle would be right there. Okay, then where number 18 is at. Okay, the coronoid fossa, which is right up in here. Okay, number right here. Okay, that would be where the ulna goes. Okay, then you have the capitellum, which is number 21. It's right over here. Then you have the trochlea, which is right. This is would be 21 would be the capitellum. Trochlea would be number 22 right in there. Okay. Then you have the olecranon, which is actually on the opposite side, right there. Okay. And there the ulna would go. Then you have the ulna, which is this one, the longer bone. Okay. The ulna then has the olecranon as well. Okay. And right now I don't know where it went. Okay. You have the coronoid process, which is right here. Okay. The styloid process, which is right here. Okay. Then you have the radius, which is the smaller bone. Okay. You have the head. The head is up here. Okay. The head's right there. Number 29 up here. Okay. Then you have number 30, which I have is the radial tuberosity, right there. You have the styloid process, which is number 31. Remember, let's pretend this is the right arm because it came backwards on me. That's the styloid process right there. Then you have your hands, which would be your carpus, which is proximal would be proximal to medial. You would have this would be the scyphoid, the lunate, okay, and then you would have the trichetral and pisiform. Then you would have the distal ones, which is number 33. You would have the trapezium. You would have the trapezoid, the capitate, and the hamate. Okay, the hallux is of course your the pollux, correction, is your thumb. Okay. Then we move on to the pelvic. Okay. Then you have the cerebellum. Okay. Your cerebellum is your. Let me see, where did it go? Right here. Your cerebellum is in there. Okay. Your pubic symphysis is right over here. Your obturator foramen is actually this hole right here. Okay. Your iliac crest is up here. Okay. Your anterior superior iliac spine. Anterior superior iliac spine is superior iliac spine. I believe it's this one. Okay. The iliac fossa is right here. Then you have the greater sciatic notch, which is actually in the back. If you turn it over around, it's right here. Okay. You have your ischium spine is right there, and then your ischial tuberosity is right there. Okay. Now we move down to the femur. Your femur is actually the long bone right here. Okay. You have the head 43 right here. Your greater torquender, okay, which would be right over here. Okay. Then you have your lesser torquender. It will be 45 right over here. Okay. Then you have ductor number 46 right over here, right there where my thumb is at, 46. Tubercle, and then your 47 medial tubercle, which is just under it. Your 48 is your actual lateral epicondyle, which is on the other side right over here of the bone. Okay, then you have number 49 where I have medial and lateral epicondyles. Then you have 50 your patella. Then we move on to the tibia, which is your longer bone. Then you have medial, which is right here, and lateral epicondyles. There would be this one and this one, okay, right here and right here. Then you have your 52 would be here, your tibial tuberosity. Then you have your medial malleolus, and then you have 50 for your which is right here. Oops, sorry. 54. Exactly where it went, I don't know. It must have erased. Then you have 55, which is your fibula, your head up here. Okay, and then you have 56, which is your lateral malleolus. Okay, that's 56 over here. Then you have, after that, you have your talus. Okay, and I used the other foot for that. Okay. 58, you have your talus. Okay, so that's your 58 is actually your calcaneus. Okay, 59 is your cuboid. And then your talus is actually it's up in there. 57 in there. Okay, and then your navicular is actually up here. Number 60. And then you have 61, which is actually all these right here. Okay, you have your medial, your intermediate, and your lateral cuneiform bones right here. Your medial, intermediate, and lateral cuneiforms. And then you have your metatarsals, which is all of these. Your phalanges and your hallux would be your toe.